Okay, so today we're diving into something pretty special.
Oh, yeah.
A tribute, actually, from a Dr. Prabodh Dhakad to his former teacher, this Dr. R.S. Mehta, for Dr. Mehta's 100th birthday.
Wow, 100th birthday, that's a milestone.
Yeah.
So what are we like, what's the focus here?
Yeah, it's not just like, happy birthday, you were great. It's really about what made this guy such a fantastic doctor and teacher, like straight from the source, a student who learned so much from him.
I see, firsthand account. Okay, I'm interested.
And the thing that, like, immediately got me was how insanely sharp Dr. Mehta's diagnostic skills were, even super late in his life.
Oh, wow.
There are these specific stories, and you're just like, whoa, this is the power of experience.
That makes you think, yeah?
Dr. Dhakad shares stories from when he was a student, and even, like, years later when he'd go to Dr. Mehta for advice on tough cases.
That's interesting. So, like, what kind of impact are we talking about here?
Well, it's pretty amazing. You see how a great physician and like a great teacher can leave a lasting mark. Dr. Dhakad talks about how lucky his whole class at MGM Medical College felt to learn from Dr. Mehta. He was an emeritus professor there.
Yeah, yeah.
So like a senior figure who is still super active in shaping these new doctors, it really shows you how deep his influence was.
I see, setting the stage for greatness. Okay, so let's dive into some specifics. What makes Dr. Mehta so brilliant, as you were saying?
Right. Dr. Dhakad uses words like clinical brilliance, sharp diagnostic acumen, but it's the stories that make it real. Like, think about what happened with his own mother after she had cardiac surgery.
Okay.
She had advanced heart failure, atrial fibrillation, severe tricuspid regurgitation after a mitral valve replacement at Chem Hospital, like a whole bunch of complications.
Wow, sounds serious.
Many doctors were suggesting a more cautious approach, but Dr. Mehta, he saw something different.
Interesting. So what did he do?
He actually recommended valve replacement surgery. And this was like back in the day when Chennai Railway Hospital was the only place in India doing that procedure.
I see. Taking a proactive approach, huh?
Yeah, it was proactive, informed, showed how aware he was of new treatments, just like decisive.
Decisive, but like based on deep knowledge and awareness,
Yeah.
not just jumping into something risky.
Exactly. And then there's this thing that Dr. calls an uncanny prediction. This was just 4 years ago. So Dr. Mehta was 96 at the time.
96. Amazing.
Right. So Dr. Dhakad was treating one of Dr. Mehta's family members in Dubai for like heart issues, atrial fibrillation, heart failure, ascites, pedal edema.
Okay, so a complex case.
Very complex. And then Dr. Mehta calls him up and says, hey, have you gotten the CT, abdomen, and ultrasound reports back? Dr. Dhakad's like, yeah, why?
What did Dr. Mehta say?
He says, I have a gut feeling about ovarian malignancy.
Wow, just a gut feeling.
Just a gut feeling. And guess what? The tests confirmed it. Ovarian malignancy.
That is uncanny. Like, how do
Yeah.
you even...
Right. It's like a medical sixth sense.
It makes you realize that expertise isn't just about, following the steps in a book. It's about having all these patterns in your head that you've seen over decades of practice.
It's incredible. And, it wasn't just these amazing diagnoses.
He was a teacher, right?
Yeah, Dr. Mehta was a phenomenal teacher.
Yeah.
And he focused on, like, the fundamentals.
Interesting.
He taught his students how to think, how to observe, how to act with confidence. Dr. Dhakad talks about how Dr. Mehta would emphasize the importance of a really thorough clinical exam.
I see. So it was like a hands-on approach, not just theoretical.
Absolutely. He'd say, look at the temporal artery, check for succussion splash in the abdomen, notice subtle muscle wasting. These are like core skills that any doctor needs.
And it's interesting how those gut feelings we talked about before, they aren't random. They're built on this like foundation of really careful observation and a deep understanding of the human body, like Dr. Mehta instilled in his students, that if you want good clinical judgment, you got to master these basic skills.
You got to master the basics. And that's really his legacy, isn't it?
Yeah, I see that.
It lives on in how his students practice medicine, in how confident they are in making diagnoses, and in the impact they have on their patients. It's more than just what's in the textbooks. It's a whole way of thinking.
It's like a medical philosophy almost, passed down from mentor to student. So powerful. It makes you think, right?
It really does.
Like about the mentors in your own life, in your own field, and about those like seemingly intuitive insights that people have, the ones that come from years and years of experience. Like what subtle signs are we missing in our own areas of expertise?
What are we missing? That's a good question.
Yeah. And maybe, seeking out guidance from those who have been there, who've seen it all, could help us connect the dots a little better.
Absolutely. Dr. Mehta's story really highlights that.
It does. Powerful stuff.
So to sum it up, this Dr. Mehta, he was like this amazing blend of sharp intellect, unbelievable intuition, even at 96, and a teaching style that emphasized like being thorough and thinking critically.
Mm.
And his impact, it's still felt today through all the doctors he mentored. It's really inspiring.
It is food for thought for sure.
All right, that wraps up our deep dive for today. Until next time.
See ya.